As we do that, the Ministry of Health will be releasing its findings on the effect of faith and on the success of family planning campaigns in Kenya. The focus is on faith leaders and their role on attitudes and uptake of family planning and contraceptives. The function is currently underway at the Boma Hotel, and we just want to cross over there and listen in to that conversation.
Prevent unintended pregnancies, and we also prevent maternal deaths. We also prevent abortions, and it has implication for population growth, which has an implication in terms of even economic growth and how we can sustain our population. Briefly, this is might be a bit technical, but this is just an S-curve, what we call the modern contraceptive prevalence rate S-curve. It talks about the levels of uptake of family planning across the whole country. These are all the 47 counties plotted there. Towards the lowest end, we see Mandera, Wajir, Garissa, Turkana, Marsabit, and West Pokot being at the tail end in terms of the percentage of married women accessing family planning services. And here, or taking up family planning services. Here it's between 1 to 10%, 1 to 14% modern contraceptive prevalence rate. And this is really the main focus that we're talking about, healthy timing and spacing, because these are the people that, for us to access and give them services, the most best way of entry is through healthy timing and spacing, because we are talking about the health of mothers and children. You can proceed. So what are the types of interventions that we have in terms of as a program when we are offering services? Within the public sector, we talk about postpartum family planning, which is access to family planning to women who have just delivered, post-abortion family planning for women who have had miscarriages or abortions, then they can have family planning services. We want to improve the public sector provision and community health workers. But of note here, what I want to highlight is the last box in red, which is demand generation. Here, this is the main entry for us, especially within the areas that have very low uptake of family planning services, which means that we need to address the demand of these services. And here we need to use mass media. We need to do community-centered social behavior change, communication, individual-based social behavior change, communication, and specifically adolescent-focused interventions. You can proceed. We did an analysis to find out within these regions that have very low CPR, which in this graph we are representing it by Garissa. It doesn't mean it's just Garissa, it just means it's those counties I just talked about that have very low uptake of family planning services. And here you'd see that the items that we can use to address how do we offer these services in these regions, the best entry is postpartum family planning, because it's about the health of the mother and children. And then the other item is post-abortion family planning for all those women who, by medical reason or whatever reason that they underwent abortion or miscarriage, then we are giving them post-abortion family planning. And then we have community-based distribution, because these regions, most of them are hard to reach, so we need to go into the communities to provide these services. And then we also have, most importantly, comprehensive community engagement. So for us to address these communities, we really have to get into the community and engage them. And the best way is through addressing the health of the mother and children, which is healthy timing and spacing. Can proceed. So the key achievements, I think I've mentioned this already, that we've already surpassed our goal for FP 2020, which was 58%. We are currently at 61% as a country. We can move to the challenges. So despite us having such achievements, we know that across the country, from the curve I just presented, we have marked disparities in terms of uptake of these services. And you see that we have as low as 2% to as high as 70%. We can move to the next. So we have so many opportunities. We know the government has mentioned universal health coverage, and this is a big opportunity for us to center ourselves as the key agenda in addressing the health of communities by offering services that actually are the pillar of the health of communities. So generally, that is what I had for today. Thank you.
So we are having very important conversations in this room, but we need to have as many people as possible talking about it, right? So we want to take the conversation out of this room through Twitter. We have a hashtag Let's Talk HTSP. You've seen it here on the right. I hope you can all see it. So if you haven't logged on to the Wi-Fi,